So we're very excited to be joined today with Dr. McNaughton Villion, who has been the Regional Supervising Coroner for Eastern Ontario, Ottawa Region since 2013, and David Razo, who is with the Bereavement Authority of Ontario in Management and Communications. All right, so I'll turn things over to you two. Thanks so much again for being here.
Well, thank you very much. Dave, do you want me just to run through the first intro slides?
Sure. Yeah, that'd be fine. Thank you, Louise.
Okay. Okay. So as you know, as you can see, it's a combined presentation we're giving. We're going to be talking about the legalities of death from the coroner perspective and the Bereavement Authority of Ontario. We have no financial interest whatsoever. We have no financial support. I'm sure it's not the first time you've heard this. And our learning objectives at the end of this session, you should be able to identify deaths where a coroner needs to be called and describe the importance of pre-planning to ensure funeral wishes, such as cremation, are respected. And finally, be able to describe the role of the Bereavement Authority of Ontario. So I get to start first talking about the role of the coroner and legalities of death. The first thing I wanted to emphasize when we're talking is that the Coroner's Act is a statute based in Ontario. It's a provincial statute, and everybody who does things in the coroner's system is defined within the Coroner's Act. So the forensic pathologist, coroners, investigators, even what the police do is all there in the Coroner's Act. And then everything that we do, seizing stuff, going into places other people wouldn't be allowed to go, looking into people's medical records, that's also based in the Coroner Act as well. So we don't color outside the lines. We follow the law and we do what's called a medical legal investigation. So here is a bright shiny badge. We each get one. We have to give it back when we stop. And we all work for the Ministry of the Solicitor General. And you say, oh, okay, so not OHIP. Exactly, not OHIP. We work with the same ministry that has the firefighters, the police, that sort of thing. But coroners are physicians. And in order to do a coroner's investigation, we have to be licensed to practice in Ontario. We also have to live in Ontario, which makes it challenging for Cornwall, Hawkesbury, Prescott Russell, that whole area, because if a physician lives in Quebec but works in Ontario, they can't be a coroner. They have to actually live in Ontario to be able to do that. As well, we're appointed by the chief coroner. We have an order. We swear allegiance. We do all sorts of privacy things. And we also get our security check done through the police and all that sort of thing before we're allowed to do our stuff, which kind of makes sense. And physicians are usually part-time. So in our region, in the Champlain region, we have a lot of family doctors, emergency physicians, general surgeons, but we also have anesthetists, neonatologists, obstetricians. It's really quite the mix. A psychiatrist as well. So what makes us different actually adds to the richness of investigations because somebody's got the expertise to look into one specific area if we need to look at it. But that also means that they're acting clinically at the same time, like they have a clinical job at the same time as they're doing their coroner work. And that's kind of nice too, because you keep up to date with the medical stuff. We also, once we hire people, so we screen them all, we figure who makes a good fit, then we have what's called the new coroner's course and a one-year fellowship program where they call us for all the cases and we discuss. The regional supervising coroner discusses absolutely every case with the coroner so that learning is really consolidated. And then after that, for years afterwards, the coroners will be calling the regional supervising coroner to ask questions, particularly if it's a child death or a homicide or things like that that are really, you can imagine, would have very, very strong consequences. So you know who a coroner is now? What the heck do they do? I had to ask that before I became a coroner, and they told me, which is good, and that's why I decided to do it. We answer 5 questions. And does anybody want to put in the chat what they think some of those 5 questions might be? I'll just give you a couple of minutes so you can type that in while I'm thinking myself. See, the 5 questions is what we call the investigative part of coroner work, right? So that's, we have to answer it. So I see cause, manner of death, absolutely, those are 2 of those 5 questions. Whether it's a homicide, whether it's an accident, we'll talk about that a little bit. Yeah. So we have to determine those types of things. We also have to say who the person is. And sometimes that's the big one. You know, we find skeletal remains in the woods, and we have to determine who that person is. There was a question of whether it happens at home, how, when, is there a crime, time of death? So yeah, who died, when did they die, where did they die, what was the cause of death, and then what was the manner of death? And again, we'll talk a little bit more about that. So that's the investigative side. Then there's the public safety preventative side. So we have to decide whether an inquest is necessary. And you may hear on the news sometimes, so-and-so has died or this thing has happened, and the coroner determining whether an inquest is necessary. It's actually not news. We have to do it for every death we investigate. We have to determine whether we need an inquest or not. And we can make recommendations to prevent deaths in similar circumstances. Now, that's the thing that gets most coroners all excited, because if one person dies, it's a tragedy. If we can do something to prevent a preventable death, that is just such a valuable, powerful thing. And the other piece is no blame, no judgment. And the reason I say that is sometimes we are contacted by families and they want a hospital to close down. They want somebody to be held accountable. They would like somebody to lose their license. And we say, well, actually, that's not our mandate. It's within the law that we cannot do that. So you're going to have to go elsewhere. And sometimes we'll tell them where they need to go, sort of thing. But we ourselves cannot do that piece. I see a note saying coroners also need to talk compassionately to the family. Absolutely. That's not in the Coroners Act, but it's a key thing that we absolutely need to do. So anybody know what the coroner's motto is? I'll give you a bit of a background. If anybody thinks they know it, they can write it in. It's attributed to Thomas D'Arcy McGee, who is one of the fathers of Confederation. And he was a physician, and he was one of our first coroner cases because he was shot and killed on Parliament Hill. And so I will tell you what his motto is. The motto: we speak for the dead to protect the living. And I like to tell people that, and it's true, that's why I tell them, it's my elevator speech. If I'm in a room with somebody and we only have a few seconds, they say, what the heck do you do? And it's also something that I say looking in the mirror before I start my day. Because sometimes it's really good to remember what the heck it is we're doing and why. So let's talk about deaths. We talked about kind of what we do. A lot of people die in Ontario. Over 120,000 people die in Ontario. And 17% are investigated by the coroner. The rest, 83%, are natural deaths. Nurse practitioner or a physician completes the death certificate. We do not get involved. When we do get involved, I'll show you the breakdown of what those cases are like. So the blue is natural. So a little less than half of the cases we investigate are natural deaths. And you say, well, gosh, why are you even investigating those? We'll talk about that. A little more than a third are accidents. And a huge chunk of those are part of substance toxicity and motor vehicle collisions. Those are probably the 2 biggest pieces of accidents, but obviously any other accidents as well. 8% of the deaths we investigate are suicides. Comes out to around 3 suicides a day in the province of Ontario. So it is something that well, all of them we take to heart to see what can be done to prevent. 4% are undetermined, and that's when it could be one manner or it could be another, and we're just not sure, or there's just not enough information. So examples of that would be the skeletal remains I talked about before. if you have skeletal remains, it's very difficult to figure out why that person died. And also for baby deaths, when we've done a full investigation, it's quite frequent that after doing a full autopsy, viruses, bacteria, a toxicology, x-rays, and a full investigation, we may still not know why that baby passed away. And we could talk a lot just about that specific thing, but those are the two probably most common undetermined causes of death, manners of death. And then that nice little sliver, 1%, is homicides. So of all the deaths we investigate, not the deaths in the province, but the number that we investigate, 1% are homicides. And that, honestly, I have to say something about gun control for that, because compared to other death investigation jurisdictions, it's a little bit more. So that is one lovely thing. The other thing to remember is that, say somebody dies of an accident, the police may decide to press charges. Somebody may die and we classify it as a homicide. The police may decide not to press charges, because our system just determines, we'll call it the truth, if you wish. You know, was this death inflicted by another person? Was it inflicted by the person themselves? Was it unforeseen? The police are looking at guilt and innocence. They're looking at that aspect of public safety. So it's perfectly understandable that the police may press charges, whereas the manner doesn't quite appear to align with that. So here are the questions that I was asked to answer, and that I was asked to answer in a few other palliative care groups. So I just thought I'd list them and then we can talk about them. Pronouncing versus certifying. What do you do if you don't have somebody to complete a death certificate? What is the Declarations of Death Act and how does that apply? When do you call a coroner? What about unclaimed bodies? What about if somebody wants to donate their body? And can a body or organ be donated for research, particularly if somebody dies at home? Medical assistance in dying in the coroner's office, how does that work? Those are what we're going to talk about today. So, first poll. Ready, Carl? Okay. So, what law is responsible for death certificates? One answer only. How we doing?
I see lots of answers coming in. We got 70% so far. It's growing, so I'll leave it on for a moment here.
Yeah. Now, all of these are related to what coroners do, and they're related to deaths. There's stuff about deaths in all of them. But there's only one right answer.
Okay, so I'll stop the poll here. I'll share the results.
Oh, look at that. Cool, cool. Okay. So for the 23% who said the Vital Statistics Act, they are correct. That's where the death certificates are. That's where they tell us what we need to do and how we need to certify. Vital Statistics Act covers birth certificates, death certificates, stillbirths, the whole 9 yards. And we will talk a little bit more about some of the other acts, though, because obviously this will be interesting, right? So, bonus question. We said the Vital Statistics Act. Is it a federal law or is that a provincial law? I'll let you throw that into the chat if you wish, and I'll just kind of talk on top of it. And I see one person has said provincial, and they are absolutely right. And there is Vital Statistics Canada, which can make it confusing. So that's why I threw it out there, because it is just a confusing thing. So each province is responsible for gathering all their death stats. So death certificates in each province and territory are going to be different. But the information that gets sent to the federal government, who publishes all this stuff, comes from those death certificates. So the death certificates themselves is the provincial law, and then the providing comes from the federal law. And this is all important stuff. We'll talk a little bit more about that after too. So death certificates. So if anybody is old like me, they like the far side. And this says, for crying out loud, I was hibernating. Don't you guys ever take a pulse? So what are you going to say? Gary Larson is one of my favorite guys. So we're going to talk again related to death certificates, these things. Pronouncing versus certifying. Why are medical certificates of death important? What's the real cause of death? And of course, if you're filling out a death certificate or you see one and it's a coroner's case, stop and call the coroner. So pronouncing versus certifying. Pronouncing is saying that somebody is dead. You walk up, somebody's lying in a room, in a bed, whatever, you say, that person is dead. I am not going to do CPR. Certifying is the documentation of the death. It's that legal form that gathers up all the stats, that tells somebody how they died, that a family can use to obtain benefits or insurance or a variety of other things, that legal document. So the documentation answers those 5 questions: who, when, where, cause of death, and of course, manner of death. So the difference between pronouncing and certifying is one is saying somebody's dead, and the other is actually writing a legal document describing it. So when you say somebody's dead, it's not a medical act, but the person who says they're dead has to actually see them. They have to be there. So a paramedic can pronounce death, a nurse can pronounce death, a neighbor can pronounce death. If they see somebody lying on the front porch and they say, oh my gosh, they're obviously deceased, so they don't do CPR on them, but they call 911, then that person has pronounced them dead. Whether they're dead or not is a whole other thing, but they have pronounced them dead. They've said that they are dead. Now, certifying, as I said, it's either a nurse or a nurse practitioner or a coroner. And we'll talk a little bit about that because we now have coroners investigators, and they are nurses and they complete death certificates. They're not nurse practitioners. They are nurses who are coroner investigators. So this is our nemesis, the death certificate. This top part has the who, name, when, date of death, where did they die? Cause of death is in here, part 1 and part 2. We'll talk a little bit more about that. And then down here, when it says if accident, suicide, homicide, or undetermined specify, that's the manner. So if it's a natural death, this part should be blank. And if you've put something in there, it's a coroner's case. So you should rip it up and call the coroner. Okay. So this, as I said, is part of the Vital Statistics Act. It needs to be legible. It needs to be accurate. It needs to be completed as soon as possible. No copies are allowed. Also, no abbreviations. So COPD, ASHD, CHF, all these things that we use as, our kind of language, sub-language, we can't put it on a death certificate. It has to be the actual words. Should never be completed in advance. I've heard that there have been times where everything's been completed and you just need to sign and put the date on. No, because until the death occurs, you don't know. You really don't know. So, and it's required for burial permits. It's required for people's estates, for their insurance, for their pension, and of course, for mortality statistics. Is how many people died due to complications of diabetes versus heart disease versus hypertension alone versus, so everything that's written in the death certificate is uploaded. And those statistics, when we compare ourselves with Japan or with the UK, what causes the most deaths? This is where it comes from. So death certificates are incredibly important. So here's this cause of death section again. So part 1 is the direct cause of death. So for example, somebody dies of a myocardial infarction due to or as a consequence of atherosclerotic heart disease. And part 2 is the contributing factors. What made it more likely for the person to die, but isn't the cause of death? So for example, we say part 1, somebody dies of necrotizing fasciitis, but they also had diabetes and they also had peripheral vascular disease, let's say. So those things probably contributed to them dying from necrotizing fasciitis, but it wasn't the cause. So we'd put necrotizing fasciitis up here and we put diabetes, peripheral vascular disease as contributing factors. So as I said, cause part one can be direct or indirect. So it could be, you could have died of a heart attack, or you could have died from a pulmonary embolism due to pancreatic cancer. So an indirect connection, but it's there. And it is the primary condition or the event leading to death. Part two, the contributory, as I said, didn't cause death, made death more likely. And I understand that the majority of people that are listening right now are not physicians. It's clinicians and social workers and that sort of thing. Is that correct?
Yeah. Actually, we have quite a few physicians here tonight and nurse practitioners, so it's a great mix.
Okay, that's great. So hopefully that will yeah, somebody's written, I struggle with how poorly medical certificates of death are completed from what I hear and see. Absolutely. Common causes of death actually are. And she says it's even more confusing with track 2 made deaths. And I'm seeing people now are telling me who they are, which is wonderful. And that's the whole point, is that we are continuously trying to help people write better death certificates, because the impact is great and the quality is actually not so great, honestly. So what if there is no one to complete a death certificate, right? That was one of the questions. Well, there is the Edith protocol. Do people still use the Edith protocol, the expected death in the home? And so that was actually something that came about from a coroner who was a palliative care physician who worked to develop this protocol that's now being used all over the place. Her name's Sue Aiken. And it is great if you can get that, in place ASAP. And then, of course, I understand, and correct me if I'm wrong, but I understand that some palliative care people are now allowed to do electronic medical certificates of death. And that is amazing, because remember, somebody can pronounce death, they have to be there with them, but the certification of death doesn't require them to see the person. If it's an expected death, if it's a palliative care death, then a nurse practitioner or the most responsible physician can complete an electronic medical certificate of death and send it to the funeral home. So that's a great way to do it if there's no one to complete a death certificate. And of course,
that was especially big during COVID, you might remember. That's sort of brought it to the fore as a regular.
Funny you should mention that, David, because that was one of the reasons why the government accepted electronic medical certificates of death. Was it happened during COVID. It accelerated the development of that, which you can't really thank COVID for anything, but isn't that interesting?
Yeah.
So this is the general number for the coroner's office. And if there is absolutely nobody to complete a death certificate, people can call this, and I have to emphasize it, it is a last resort. It's not great for the family. You have to have the police there. It's like there's just lots and lots of stuff that, and it takes a lot longer, because the person who would fill out the death certificate knows the patient and has, is looking in the EMR and has it all kind of somewhat figured out. Whereas the person who's being called at the coroner's office is now going into Connecting Ontario, speaking to the family, speaking to the police, getting a lot more information, because they really don't know that person until they got the phone call. But that is the number, and you'll get the slide deck, so you'll have the number as well for the 1-800. And if you call and it's a natural death, then the coroner's investigator takes that. And that is a nurse, and we'll talk a little bit more about that. They have special training and are supervised by our chief coroner. And if it's a non-natural death or a natural death with issues, we'll talk about that, then it's transferred to a coroner. But remember, even if there is somebody to complete a death certificate, if it's a coroner's case, they should be called. So who is a coroner investigator? Well, they're appointed by the chief coroner. They are nurses. They take care of all the non-coroner cases when there's no physician or nurse practitioner, and they provide the medical certificate of death to a funeral home. And as I said, it's the option of last resort. They do not conduct coroner investigations in these cases. So families have approached us afterwards when they heard that the coroner's office was called, and they say, we'd like to know what the postmortem showed. And we said, well, we didn't do one because it's not actually a coroner's case. This is a stopgap because there's nobody else to do it. And we can't leave the family bereft. We can't leave them with nobody to do the medical legal paperwork. And it would be lovely if we didn't have this job, to be perfectly honest. We do. So we don't do an investigation. So there's no postmortem, there's no report. And again, as I said, if it's recognized as a coroner's case, then it's transferred to a coroner and the coroner takes it from there. So on to the next question, the Declarations of Death Act. And that was an interesting one. I didn't even know about this act until I was a coroner for like 10 years. Because it's not related to coroner's investigations at all, Declarations of Death Act. You say, well, what the heck is it then? Well, it's not related to medical certificates of death either. The Declarations of Death Act have nothing to do with death certificates. What they have to do is a person who believes that somebody is dead, but there's no body, have to approach a judge who will say this person is dead. And there's two situations where a judge will agree that a person is dead and they will declare that person deceased with no death certificate. That is if they disappeared in circumstances of peril. So they fell off a boat in stormy weather, right? Or something, or they fell off a cliff when everybody was hiking. They fell off a cliff and people saw them fall off a cliff. And since that time, there's been no communication from that person. There's no reason to believe that they are alive, and there's sufficient evidence of death. So that's one. And then the other time is when it's a 7-year absence. So somebody went off for a hike in the woods and nobody's heard from them since. And no body's been found. There's no activity on their credit cards. There's no anything. And so they are absent. There's no communication. There's no reason to believe that they're alive. So if you think that they, left because, during the Vietnam War, a young person left and maybe you're thinking, well, they were just trying to not be recruited. That sort of stuff. It has to be where you have no reason to believe that they're alive and there is sufficient evidence of death, and they have to be absent for 7 years. So this is what the Declarations of Death Act is. It's so for all of us, it probably doesn't apply, but it's kind of a neat bit of info for you to know about, and I'm glad you asked.
Louise,
yeah.
Just before you go to that poll, there's a few questions about death certificates. So
sure.
Okay. So Pat asks, where do you get the certificate where at the scene of a death? I'm assuming they're referring to a home death.
Uh-huh.
If it was somebody who had the Edith protocol, they would have the certificate tucked into the chart in the home or that kind of thing. But
yeah,
how else would the death certificate appear?
So obviously electronic is a whole other thing. The electronic death certificate, people who are allowed to use that modality have that on their computer, so it's all set. The paper ones, there's a couple of options. I would say that if you are doing palliative care, that you should be contacting the registrar's office, which is in Thunder Bay. And I'm pretty sure on that, in fact, I'm absolutely certain, I don't want to go back to that slide, but in the slide deck where I show the death certificate, at the very bottom, there's a 1-800 number and an address that you can contact to get death certificates. If you're leaving from the hospital to go pronounce somebody, they have them at the hospital, you can ask. But I would say it's better to just kind of stock up to make sure that you have them. I know here at the coroner's office, we have over 1,000 death certificates and we just hand them out to our coroners as needed, sort of thing. And sometimes funeral homes have these, believe it or not. Sometimes they do have the death certificates. But I would say, as with everything else we're going to be talking about, planning ahead is really key. So contacting the registrar's office in Thunder Bay, even if you Google it, if you say Registrar's Office, Thunder Bay, Ontario, I bet you're going to see a phone number and an address that you can contact. And like I said, if you get, go ahead.
Go ahead. You finish.
Okay, I was just going to say, but in the slide deck, I know that at the bottom of that death certificate, you'll see that. Yeah.
Okay. So another question was, can a nurse practitioner sign a death certificate if they've not followed kind of the end of life trajectory from the beginning to end?
So my understanding for a nurse practitioner, and obviously the nurse practitioners would know better than I, is that it needs to be an expected death. It can't be an unexpected death. So if they are a nurse practitioner who's shared care and know the diagnosis of the person and know that the person is having palliative care and et cetera, then yes, they can complete the death certificate because it's an expected death and they have adequate knowledge to complete that document. But if it's unexpected or something of that sort, if you're in palliative care, you can pretty much say it's expected. It's expected from a medical health practitioner's perspective. It's not unexpected from the family's perspective. And I will give you an example of that. We sometimes will get a call because a family will say, well, we knew he had end-stage cancer and we knew he was going to die in the next 3 months, but he died in 2 weeks. And we weren't expecting that. We thought he'd have more time. Well, from a healthcare professional's perspective, it's part of the range, right? So you would say it's not really expected from a healthcare professional, but obviously from the family, it would be. So does that help?
Yep. And Valerie Cooper, nurse practitioner extraordinaire in Kingston, said this law just recently changed to allow NPs to complete without prior involvement.
There you go. Okay.
But interestingly, somebody actually asks, they have a clinical example and, how to fill out the death certificate, a patient with a pulmonary embolus from pancreatic cancer. What if you suspect a PE, but are in a hospice setting and no tests have been done? Do you put down a pulmonary embolus or just pancreatic cancer?
What a great question. Okay, so the decisions, and we may talk a little bit more about this, the decisions for completing a death certificate are the same as civil law, which is the balance of probabilities. So what is more likely than another? So if based on the clinical history, it is more likely that a person had a pulmonary embolism than a stroke or a heart attack or something like that, then you can write on a death certificate pulmonary embolism, remembering that you're absolutely right. If the underlying cause of the pulmonary embolism is pancreatic cancer, that's what's going to get brought into the statistics anyway. So you don't necessarily have to say pulmonary embolism if you don't want to, because the underlying cause of death is the pancreatic cancer. So my answer is it really depends. It depends on your level of comfort. The underlying cause is the same. So if you feel that it's helpful for somebody to see and understand how somebody died from their pancreatic cancer, then put it in. And if you say, you know what, the underlying cause is pancreatic cancer, and I don't really want to give an opinion as to whether it's something else, then you could just put pancreatic cancer. And that's the beauty of well-trained health professionals is they can look at the case on its merit and decide whether it's necessary or not. And if so, on the balance probabilities, certainly put it in if they feel that it's necessary.
Thanks. We're good to go with your next poll.
Okay. So when should you call a coroner? When it's a death at home? When body donation is being considered? A recent fractured hip? Family wants an autopsy. So I did it backwards. There we go. There we are. So go ahead and vote away.
All right, I'll share the results here.
That is great. So I was saying this is kind of a trick question because there should be question number 5, which is it depends. Because deaths at home, only if there's not a healthcare practitioner able to complete the death certificate, right? And only if it's non-natural, or we'll talk about natural deaths with issues a little bit later. If body donation is being considered, actually, you don't need a coroner to help a body be donated to a university and all that. We'll talk a little bit more about that. Recent fractured hip in palliative care, more likely than not, you are going to call the coroner for those ones, because if they have a recent fractured hip, if they had one in the past week, then there's a high likelihood it has impacted the death. And as soon as something non-natural has impacted the death, then you would call the coroner. But if it was if it was a metastatic cancer to the bone and they were just turning over and they broke their hip, you might not, because that it's kind of an almost atraumatic injury. But in most fractured hips, it's a good idea to call the coroner if there's a fractured hip related to it. And if a family wants an autopsy, only if it meets the criteria for a coroner's case. And of course, it depends on why the family wants an autopsy, right? Because if they want an autopsy because they're angry and they believe that somebody killed their loved one, then yes, you should call the coroner. If they're concerned because the diagnosis took 2 years to be made and they believe that that had an impact on the death, then again, that would be a reason why you would call the coroner. So all of these answers could be yes, could be no, with the it depends. And I just did that to get your brain cells moving. So what is a coroner's case? And you can see there the sniff test. So you kind of, it's one of those like where you go, I kind of know it when I see it, but non-natural deaths. So anything that's non-natural. And I'll give you an example. Somebody who's paraplegic because they were in a car accident 30 years ago and they die of urosepsis because they have an indwelling catheter. You say, why did they have an indwelling catheter? Because of the injury from the motor vehicle collision. So that would be a coroner's case. So there's no time limit for non-natural. And I'll give you another example. If somebody broke their hip a year ago, but they got up, were walking, and were back to their normal self, then it's not a coroner's case, because yeah, they broke their hip a year ago, but they were back to their usual. So that wasn't a factor in the death. So any death where a non-natural event contributed. So we call it the but-for rule. But for this happening, they wouldn't have died today. So you've got somebody who's in palliative care and they fall out of bed and they have a head injury and they immediately have a decreased level of consciousness and probably had a bleed because they fell out of bed and hit their head. Well, even though they have end-stage cancer, but for the fall, they wouldn't have died today, probably. Like if you see the trajectory doing that. I'll give you another example where it's the inverse, though. They fall out of bed, they're in end stage, they're brought back into bed, they're still where, they haven't changed that much. They're end stage dying person. And they just happen to fall out of bed, but there's no injury noted. And there doesn't appear to be this acceleration of death afterwards. Well, you don't need to call the coroner for that one because that fall out of bed was not a factor. And of course, you don't put that on the death certificate then either, because you don't want it to come back from the registrar's office. Any in or related to pregnancy. Now, this is one that's like you're going, okay, non-natural, I get that. You go, why pregnancy? Well, because in pregnancy, you've got a lot of healthy people who, why are they dying? And often the chance of it being preventable is there. So if a person dies while they're pregnant or within a year of being pregnant, whether that pregnancy stopped with a termination or a live birth or a stillbirth or anything like that, within a year of a pregnancy, the coroner should be called. Any care or access to care concerns. So they were in the waiting room for 12 hours and they died of a heart attack in the waiting room. That's a natural death, but there's some concerns, right? So the coroner would get involved with those. Any allegations of neglect or abuse. We often will get a call from somebody saying, I think Aunt Joan poisoned Uncle Joey, and we say, okay, tell us more. We look into it to make sure that that isn't actually the case, and there are some times where people are being cared for at home by their family and have pressure sores. And there's a concern about that. So we will look at those, to see if there's anything, preventable deaths, right? The whole thing is preventable deaths. So we've talked about non-natural in a few categories. Then there's this kind of global category of natural deaths in those at risk. And you say, well, what do you mean by at risk? These are people where somebody else is feeding them, somebody else is getting them dressed, somebody else is giving them their medications. Maybe their only way they can get in and out of where they are is with the help of somebody else. And you say, what does that mean? Well, it can mean somebody who's incarcerated. It can mean somebody who's on a psychiatric ward. It can mean somebody who is in custody with the police. It can mean somebody who's in a group home for the developmentally disabled or psychiatric patients. It can mean somebody where Children's Aid had, and this is a memorandum of understanding that we have, where Children's Aid is involved in the past year. So even if they die of a natural death, if Children's Aid has been involved in the past year, we should be called and we should be investigating. If anybody dies in restraints, so if you got an elderly person who's very agitated or a psychiatric patient who's really agitated and they are put in restraints, then and they die while in restraints, then the coroner needs to be involved. And of course, any unexpected natural death of a child or a young person. So for example, somebody runs a marathon, they're 24 years old, and they suddenly die at the end of the marathon. We need to investigate. And the reason that we need is, again, that idea of preventable deaths. If somebody's 24 and they died suddenly, and they've been perfectly healthy before, what the heck happened? And could it be that other people in the family will be impacted by a congenital heart disease or something else that we're not aware of? So again, the idea of finding out so we can prevent. So you say, well, gosh, okay, I get it. I think I know when to call the coroner, but is there ever a time that we would call the coroner before somebody dies? Now, I've got to say, sometimes we do get calls from palliative care asking about stuff ahead of time, which is perfectly fine. But the times where it's actually written in the law that you can call before somebody has died is in the Trillium Gift of Life Network Act. We actually get called if the likely cause of death is going to be a coroner's case. They need to call us while somebody's still on life support. They may be diagnosed brain death, or they may know that life support will be withdrawn and that they will likely die within a short period of time after that's withdrawn. So the reason why it's written into the Gift of Life Act is that you cannot call them after the person takes their last breath and then say, "Hi, coroner, we want to transplant the heart." I mean, that's done. Or we want to transplant kidneys. Well, that we need to do within a couple of hours of systemic death. So that's why the law was written that way. It was so that the coroner could get involved and the decisions could be made and people can donate their organs or tissue as needed. And you don't need to call for deaths at home, because that donation, if it's a made death right now, my understanding, and correct me if I'm wrong, my understanding is if it's a medical assistance in dying death and the person wants to donate, it still has to be done in the hospital because they need to have a timely transfer for organ donation. So when not to call the coroner? When the family or the physician wants an autopsy, but it's not otherwise a coroner's case, we can't take it. Even if the family wants to know exactly how far the cancer spread or whether there were other illnesses in the body or something like that, we actually don't have the mandate and are not allowed legally to take the case. If the family wishes to donate the brain or the body to research or a medical school, that is something that needs to be discussed ahead of time. And it can be done. Like, we've had people donate their brains for Parkinson's research, Alzheimer's, chronic traumatic encephalopathy. The brain for Alzheimer's goes to Nova Scotia. Parkinson's is done in Ottawa, and CTE is done in Montreal and in Toronto. But it has to be arranged ahead of time because you need to make arrangements to have the brain removed and fixed in a short period of time and sent to where it needs to go. It all needs to be done before death occurs, because there are certain organs that deteriorate so quickly after death that you cannot take the time to get the paperwork done, So if the family says they'd like to do that, then they need to get on it and, you know, Google where they need to go and contact the people and get that all set up. Medical school donations of bodies isn't quite as stressful as that. But it's always good to get it done ahead of time because you want the families to have a chance to talk about it and understand why their loved one wants to donate their body to a medical school. The University of Ottawa has an amazing body donation program. It's got the highest numbers of any university in Ontario. Toronto's a little higher, but they have a higher population too. And they, if you Google University of Ottawa body donation, the link to the paperwork is right there. The phone number is right there. And they will take a phone call on the weekend and get that done. It has to be done within 72 hours. And there's some criteria that has to be met. But it doesn't need a coroner. If there's a primary care provider, we've kind of talked about that enough. And if, of course, you have any concerns, err on the side of calling. That's why we have somebody available 24/7. It's so much easier if it's arranged ahead of time again, so the family just knows what's going on, and the person who's passing away has their wishes respected. So we talked about donated for research, or a body and organ to be donated for research to university. Yeah, I think we talked all about that. So now we're going to switch gears and talk about unclaimed bodies. Ready for the poll. So which of these people would be unclaimed? A person receiving care at the Ottawa Union Mission Hospice with no next of kin found. A military veteran with no next of kin found. A person with $1.5 million in property investments with no next of kin found, but the public guardian will manage the estate. And a person receiving Ontario disability support payments where the family has no money. So you can answer as many of these as you'd like.
Good. I see people are contemplating this question, so I think we'll give it another moment here.
Okay. Okay, so while people are answering the question, I see that Valerie Cooper has said there was a case in Toronto where an ALS patient donated after death at home, where MAID was started, and then they were intubated and they were transferred to a hospital for recovery. That would really have to be organized. I could see that being very challenging for many people.
About in the case of a suicide, so the coroner would be involved.
Yes.
Would there automatically be an autopsy?
Not necessarily.
Okay.
It really depends on the circumstances. If a person dies by hanging, which is the most common suicide at home, an external exam is usually what's done. We don't normally do full dissections. If somebody makes a suicide attempt and is partially resuscitated and is in the hospital for a few days, then we may not do an autopsy because often they will have had scans and examinations. If the police were involved to check to see what the story was, the family will have had a chance to kind of figure things out as to what happened there as well. So there are some cases where an autopsy is not done, but I would not say 100% one way or the other, It really depends on the circumstances. Okay, so sorry, do you want to show the poll there? Great. Okay, this is why I wanted to ask you guys this question, because we are so lucky in the city of Ottawa. It's a little different in other regions, but in the city of Ottawa, inner city health will claim a body of a person if there's no family. We'll have a celebration of life at Union Mission or at the Shepherds of Good Hope, and we'll cremate, and there's an area where that person's ashes are buried. And it is incredible and something that just lifts my heart when that happens. We always look for next of kin first, though. Military veteran, are they unclaimed with no next of kin? This applies across Canada. There is something called the Last Post Fund. So if somebody is a military veteran and you know that before they die, they can contact the Last Post Fund, or you can even contact on their behalf. And the Last Post will arrange a really lovely funeral and interment for the military vet. But somebody has to reach out to the Last Post. We do it a lot from, I am also a local inspector of anatomy. This is all under the Anatomy Act, unclaimed bodies. And so I complete paperwork. So if I see if somebody's a veteran, then I will contact the Last Post and make sure. But that can be done ahead of time as well. Okay, get this. A person with $1.5 million in property, no next of kin, and the public guardian will manage the estate, they're unclaimed. They are absolutely unclaimed. If they don't have a will and they haven't made any arrangements, they will get the same municipal burial as somebody who had absolutely no money at all and no belongings. The public guardian does not discriminate. It's just done that way. So again, just a plug for, that breaks your heart too. Like I've had people I've taken care of unclaimed bodies, and I've said, just please anybody, please, 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 just say you're going to help make arrangements. There's money in their estate. But if there is nobody who is willing to claim, and anybody can claim a body, next of kin would take priority. The executor of the estate would be the first person that would make arrangements for funerals, but really anybody can claim a person's body for burial. And a person receiving ODSP, family has no money, that is an it depends answer. Because if somebody is on Ontario disability support payments, they're already known to the municipality. And if the family contacts the municipality social workers, they'll help them make arrangements for a funeral, and they'll have a nice funeral or a cremation and have the ashes returned to them if they want. It's actually quite nice. So yeah, so I wanted you to be aware of that, because we have been seeing more unclaimed people in hospices whose bodies are unclaimed, people who die at home without a will, whose bodies are unclaimed, and that is a bit of an issue. So we need end of life planning. Everybody, when you go home, think about pre-arrangements and appointing an executor. Make sure you have your will in order. If it's a death at home, no next of kin, you call the coroner, and then the coroner will help figure out who's gonna claim that body. That's for deaths at home, though. That's not for deaths in hospital or long-term care, or even in hospices. The person in those areas do not call the coroner. They actually have custodianship of the body, and they are responsible, and they need to do a next of kin search, but they don't necessarily, if they've talked to the person ahead of time and the person says, I have no next of kin, I have, here's what I want to have done, or something like that, then, and you help them make arrangements, then things can happen. But if they just tell you, I'd like to be cremated, and I think I've got a brother or sister somewhere in Ontario, but we've been estranged for 10 years, then you're going to end up having to do a search for next of kin. And you cannot respect their wishes for cremation unless it's in writing. So that always breaks my heart too, is when I'll get, friends saying he wanted to be cremated. And I'll say, okay, did he write it down anywhere? No. Does he have any family that can consent to cremation? No. Then we cannot respect that wish, because we have no written documentation or somebody to consent. So there is a process for next of kin search. If you are involved with the hospice and you don't know if you've got that, this is the email you can send to. That's our regional office. And this is the phone number for the regional office, and we can send you the documents. Most of the long-term cares and hospitals have it, but sometimes it's been a while. They're from a region where there's always somebody who claims the body. So it's a bit of a surprise. So when you get the deck, you'll know where to find it. And then once you have the documentation to show that they're unclaimed, the police have sent you an email saying, we've done this, 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 this. You say, I've looked at this and this and this, and I see that there is no family. Neighbors said there was no family. Friends said there were no family, and nobody wants to claim. Then you can send the paperwork to that email, and documentation will be completed for unclaimed. In the meantime, the long-term care hospital and hospice are responsible for storage of the body. So that's the other reason why it's really good idea to get it done ahead of time, because otherwise you're going to have to contract with a funeral home for storage. So last thing, medical assistance in dying and the coroner's office. So I will share just a little bit of information, because it's one of these things that we were the only people who could do the stats. So the province asked us to do it. It's different in every province and territory how medical assistance in dying is overseen and calculated and submitted to the federal government. But in Ontario, this is the way it works. So there have been a little more than 23,000 medical assistance in death, in dying deaths since 2016, since it was taken off the criminal code, and close to 5,000 medical assistance in dying deaths in 2024 across the province. Equal female male, pretty much. Preponderance white. Quite a variety of ages, as you can see, as young as 18, and as old as 114. And you can see the conditions. Vast majority are cancers. Oh, and by the way, but the average age is quite high. So there aren't a lot of these very, very young people, and they're very particular situations. So the vast majority are cancer related. Then you've got neuro, which is usually ALS, people with ALS or people with strokes or things of that sort. And respiratory, congestive heart failure, COPD, that sort of thing. Circulatory, people have got really, really bad, again, CHF, coronary artery disease, that sort of thing. And here is the breakdown of where medical assistance in death occurs across Ontario. So more than half are in private residences. And next to that, around a third in hospitals, and then 4% in palliative care or long-term care. So I was asked about the stats, so I thought you might like to see that. So how does the Chief Coroner, Office of the Chief Coroner get involved? Well, it's because they needed somebody to do the monitoring and oversight. So there is a centralized team in Toronto that gets all the records. They are, again, registered nurse coroner investigators, and they work directly with the Chief Coroner. And all of the deaths are reviewed retroactively to determine if they're compliant with all the legislative requirements, right? Because if it's not done according to legislative requirements, it's actually a criminal thing, a criminal act. So it's really important. And regulatory body guidelines. So they see about the clinical assessment, the diagnostic approach, and whether there's a need for further investigation. And then it reports these to Health Canada. And they do that on behalf of the providers have made, because there needs to be federal reporting so that they understand what's going on in each province as well. So a made case review, the coroner investigators have the authority to review this because in the Coroners Act, it says they can under the supervision of the Chief Coroner. They make sure the data is complete for submission. Again, as I said, legislative concerns, need for follow-up. They communicate with the families now if there are any concerns or issues. Used to be they'd talk to the family for absolutely every case. Now they do not. If they see that everything is in order, unless there's something that arises from the investigation, they don't necessarily speak to the family. And they identify and contribute to opportunities to improve made practice and provisions. And they advise on public health issues and trends. And so you may have seen some of the letters or recommendations that are now coming from the MAID Death Review Committee. And the MAID Death Review Committee is comprised of MAID providers, ethicists. There are some people with, you can't really call it lived experience, but people from the public, so to speak. They've had some interesting conversations, I've been told, because they've got some people that are really pro MAID and other people that are not, because you want to have a balanced approach to these cases, right? So in summary, end-of-life planning is essential for both donation of organs or tissues or bodies or any of that sort of thing, medical certificate of death completion, and funeral arrangements. And if you call the coroner when the death is non-natural, even if everything's in order, natural death with specific issues in high-risk populations, and deaths at home with no next of kin. For MAID deaths, just so you know, there is a reporting and review system. All death reviews are performed by the MAID investigators under the Chief Coroner, so there is oversight of this. So that's it from the coroner side.
Thank you so much. What a lot of information. I feel like I'm going to want to watch the recording again. There was a couple of quick questions. So what is the cause or manner of death on the MAID certificate, on the death certificate, if somebody's had medical assistance in dying?
Yeah, so it is the underlying cause of death. So this is something that was decided by the provincial government, because up until it was decided by the provincial government, it was messy because the actual act leading to death was administration of medications, usually intravenously. But the decision that was made once it became an exception from the criminal code and a process that is really is part of the Ministry of Health, that sort of thing, they said all death certificates on MAID should have the underlying reason for MAID. So if you had ALS, the cause of death is ALS, natural death. If you fractured your hip and 2 weeks after fracturing your hip, you went, I'm never going to walk again. I would like to have medical assistance in dying. Then the cause of death would be complications of a fractured hip, and the manner of death would be accident. And the nurse investigators would be working with the chief coroner to do that bit.
There was another scenario earlier of, whether a coroner would be involved. So a patient who's known to eat too fast that needs supervision, but the team leaves them unsupervised while eating and they choke to death.
Oh,
And
that's an unnatural death. That's a coroner's case. Absolutely.
Yeah. We'll maybe do a couple of more here. Valerie commented, there are still provinces and territories that require overdose of midazolam and propofol or medication toxicity, but this violates privacy as the MCODs are public documents.
Yeah, so that was exactly it. And what's interesting is, speaking with our chief coroner, he said the reason that they wanted the underlying reason for MAID as opposed to, what was just written there, is actually to protect the privacy of the MAID provider. So anyway.
And would the MAID provider have filled out the certificate of death?
Yeah. And that's exactly it. The MAID provider completes the certificate of death unless it's a non-natural underlying cause. And so that was one of the reasons that the decision was made, that the underlying reason for medical assistance in dying, and then the physician would complete it as that. It's an agreed upon convention, is the way I would put it.
Carmen asked, if a patient has a prepaid and arranged funeral, but no claimant, are they still an unclaimed body?
That is such a great question, because we've just been working through that. I would be, up until 5 years ago, we would have said unclaimed if nobody was willing to do it. As it is, particularly if they asked for cremation and there was nobody to sign for cremation. But now, if we receive, if everything is, if it is absolutely paid, everything is taken care of, it's been signed by the person who is going to pass away, and David can weigh in on this as well, because this is part of his area. We've said that we've said from our perspective that's fine, but we can't give it approval, we can just say if it's claimed or not claimed,
Yeah, the key is for people to know about that pre-arrangement or prepayment. If it's prepaid, it'll be easier to find because there'll be a document, there'll be a contract. Pre-arrangement, that would be at the funeral home most often, and someone has to know that. So someone in the family has to know, or the deceased would have to in advance have made that document available to wherever his health or her health was being provided.
Great questions. Lots of interesting scenarios. So
Really interesting.
there's one more related to MAID, and I think referring to the track 2 MAID, what is happening with diagnoses that are not terminal being causes of death in MAID cases, and how is that affecting vital statistics?
So I do not feel qualified to answer that question. I understand that there's a lot of learning going on with the track 2, and I understand that the cause of death is still going to be considered the underlying cause of death because there has to be a reason for medical assistance in dying. But I don't know how that's affecting vital statistics. It's really quite new, but being tracked.
Great. So I think on that, we can turn things over to David.
So I'm going to put myself on mute and I'll just be your clicker. Okay.
Thank you, Louise. I appreciate that. And thank you, Valerie. It's a pleasure to be here. My name is David Brasso. I'm the Manager of Communications at the Bereavement Authority of Ontario. You'll all be glad you had your dinner some time ago because some of the topics and subjects are not conducive to a happy dessert. Part of my job, all of my job actually, is communications, but it includes marketing. And I have to tell you, we're a pretty hard sell. It's a topic people don't want to talk about. And but when they do, their families and the individuals themselves can breathe a sigh of relief. When you make your plans, if you have a will, and we recommend, we're not in the wills business, we don't regulate that, but we recommend people have them because in them you can include your death care wishes and resolve many of the issues, a few of which that have come up during the doctor's presentation. And I'll be talking a bit about some other things as we go along. First, I'll just tell you a bit about us and we can move on to the next slide. Thank you. And here are the topics. So I'm going to tell you about the BAO. We have a do and don't list in terms of planning your funeral arrangements. Who decides? So who has the authority to decide the disposition, the person's preferred method of final disposition? Death at home, nursing home, hospice. Transfer services. A lot of people don't know that there is such a business per se, and there are some of them work with or are part of, say, a funeral home that may also have a transfer service license. Talk about that a little bit as well. Green burials, price lists, and how licensing preserves cemeteries. And then just some links where you can refer to some information we provide free of charge. We very much want you to know these things and make use of it when you need them, and preferably in advance. Thank you, Louise. We're all about consumer protection. We're delegated by government to regulate the sector. Now that sector is funeral homes and the directors who work there, pre-planners who exactly that, help people pre-plan their funerals or things that revolve around their choice of final disposition. We also regulate cemeteries, crematoriums, and alternative disposition operators. I'll get into that a little bit later. Transfer service operators and sales people in our business, let's say. And they are businesses out there and they're regulated by us on behalf of government. They pay us fees, and that is our entire financial basis. So we do not receive tax funding, but we are delegated by government, by the Ministry of Public and Business Service Delivery and Procurement. So we are overseen by them, and we work with them to make sure they know what we're doing and that they are aware. And that's really us in a nutshell. But a lot of people wouldn't know that we're not taxpayer funded. So that's something we'd like to tell people. We have information available in a lot of different ways. Probably the thing that I like to promote the most, and that I do, and I use a lot of different ways to do that, is our consumer information guide. It's a 24-page document. It's easy to read. It's written for the general public. And it just spells out all of your options as a family or as someone planning your own funeral and death care arrangements. It talks about your rights as a consumer. It tells you where you can get more information, and it goes into a lot of interesting things you might not know about death care arrangements, pre-planning, prepaying, the fact that you can actually provide your own transfer service if you're a family member of the deceased. You can provide the transfer of that person, say the person died at home, and after there's been a certificate of death and those arrangements are done, then that person can be moved from one place to another, to the funeral home, for example. So a lot of people don't know that they can do that legally on their own. You don't have to hire a company for that or a person for that. We do inspections because as the regulator, we also make sure that all of the businesses and individuals that we license, and there are 9,600 of them in Ontario, that they're following the law and that they're being professional. And by and large, they are. I always say to people, someone's deciding to go into business. They don't randomly think, I think I'll start running a funeral home or a crematorium. You have to already have an interest really in helping people at usually what is the worst time in their life, or a difficult time at the very least. Even in a death that's expected, it's still a difficult time, as I'm sure you all know. Then we have a licensing department and complaints. So we take in complaints about all of the people and businesses who we license. We also take complaints about ourselves if people have any, and there's a methodology for that as well. And like I said, it's all about consumer protection for us. We welcome people to visit our website, to even call us. We're old school. We answer the phone, we answer your questions, or we direct you to someone on our staff. And we're not a very big organization. We're about 42 people in all. And they'll answer your questions quite happily and direct you to wherever to get the information, or they will just tell you what you want to know, which is most often what we do. Okay. Yeah, so do and don't of funeral planning. And if questions come up on the feed, Valerie, I'm happy to answer them as they come in. That's fine. So like I said, write a will, please write a will. I wrote one years and years ago. I have to write a new one because I put my dog in it and he's already on the other side. So good to keep these things up to date. The other thing is tell people. So sure, plan your funeral, prearrange or prepay. It's your choice. But tell somebody. In fact, tell many people in your family that you've done this. So it's not a surprise to anyone, and that they know where they can either find the document or they know what your wishes are. And sometimes it's a subject that, as I said earlier, people just don't want to talk about. So it goes unspoken throughout the majority of a person's lifetime. And when that person dies, even their spouse might not know what their death care wishes were. So it's important to talk about it. I want to be cremated, just so you all know. So there you go. Yeah, I get pretty used to talking about it. And I think it's important that people have, believe it or not, a comfort level with talking about death and end of life. Many people have been talking about MAID as well. And I think there's a change happening within Canada with all of that activity in terms of MAID, and I think it may help with decision making at end of life, so that people know what mom or dad's wishes were long before they pass away. So there are lots of kinds of disposition, believe it or not. There are many not yet available in Canada, but you might read about in the US. So the US, being a much larger population, have accepted more forms of disposition than we have in Ontario, for example. And the Bereavement Authority of Ontario is a regulator just for this province. So obviously we have burial, but we also have green burial. And what's that? Well, it's actually not differently are not delineated in the Act, the Funeral, Burial, and Cremation Services Act. A green burial, you could say, is the most traditional and perhaps oldest form of disposition that we have. So hundreds of years ago, your burial would have been pretty green. There, wouldn't have been too many chemicals involved. There were no hermetically sealed coffins. There were no aluminum coffins, none of that. There were concrete vaults and that sort of thing. No, they may have been stone, but so it really is sort of going back to old times in a way, and it's more and more popular among younger people and among older people as well, because they like the environmental side of it. The body decomposes, perhaps in a shroud or perhaps in a wooden, very plain casket. But the decomposition would start occurring much sooner than it would in, say, maybe more old-fashioned coffin where the seal is tight. It's down well below, more than 6 feet or 6 feet underground. Those sorts of things can make decomposition a much more lengthy process. Also, embalming isn't something people readily assume they're going to do anymore. That's changing. And there's no law that says a body has to be embalmed. So, we ask people really to think about it, and so they're aware of their options, and that their families, very importantly, know what they want. I mentioned alkaline hydrolysis. Some of you might know what that is. We have 6 such operations in Ontario, not very many. And it's a chemical decomposition of the body. The body's placed in a cylinder, a metal cylinder, and chemicals are applied with a mixture of water, and the body is decomposed quickly. It happens in one afternoon, and the family receives the remains that resemble somewhat cremated remains. Obviously, there's no flame involved. So that's something that's happening, and people like the environmental side of it. But it is a chemical process as well. So others maybe don't see it that way. But that's something that's been going on in Ontario for about 10 years and increasing in popularity. Human composting is not yet something very popular in Ontario, but we are getting some questions about it. And it is just like it sounds, really. And like I said, I hope your dinner has been well digested. So human composting is a decomposition of the body in a very natural way. And the remains are mixed with all kinds of different vegetation, various sprouts, and within 6 weeks, and the remains are added in with topsoil as well. Within as little as 6 weeks, the remains are ready to be spread. Could be in a garden, could be anywhere you want it to be, where the land owner, wherever it might be, is okay with that. And so more often than not, people will do that on their own property. Cremated remains also have one similar aspect to this, and that is you can have your remains in an urn, or they can be buried, just the way a coffin is buried, or they can be scattered. And they can be scattered anywhere on Crown land. You don't even have to ask anyone's permission. You can just do it. It's perfectly legal. Over water, again, that's on Crown land. And also in your own backyard if you wanted to, because you don't have to ask the property owner. You are the property owner. So you could make those arrangements with your family in advance. So those are some of the more interesting options out there, and can be part of your plan, whether it's prepaid or just prearranged with no money changing hands. That's perfectly okay. Thank you, Louise. Oh, and I've already talked about this stuff because I'm a PR guy, and we talk a lot. But so yeah, pre-arrangement is very important. You can pay later. That's perfectly fine. The funeral home operator, usually the funeral director, actually will keep a document on file with your wishes written down. Tell your family where that is. No one will know if you don't tell them. So we always advise people to do that. If you prepay, your money's protected in trust. And if the funeral home, even if it goes out of business, over time, say you die 30 years from now, or after you've made these arrangements and the funeral home has changed hands or it's gone out of business and no one knows where the files are. Well, those files will move to the funeral home nearby, a funeral establishment, who's taken over that previous business, or the files are moved to there. If not, the Bereavement Authority of Ontario can tell you how to access them and will let you know what that person's arrangements were if you don't happen to know what, say, your uncle's arrangements were, if you happen to be the estate trustee or something like that, and you just don't know. So we can guide you when it comes to that too. But the easiest solution, again, is to let your family and friends know where your arrangements are, especially those closest to you, of course. Thank you. I've seen a few texts go by. Are there any questions in there, Valerie, or are we good?
Yeah, and I don't know if this is something you might address in a little bit, but somebody was asking a question about what would happen if the death of a family member occurred outside the country? Who would be kind of the go-to person to help with bringing the body back?
Yeah, so that does happen. You would go to a funeral establishment and they know how to do that. But there's a company that most of them use. And I'll tell you, they're called McKinnon and Bowes, and they often provide that service. And I believe others do too, but they're a very big one. And they will make arrangements with whichever country the person has died in. And they have to follow the laws of that particular country, which can be quite different about transporting human remains. But it can be done, and there's in fact a federal government webpage on it. And that's something that is linked in our consumer information guide. I just can't remember the exact URL. But yeah, it's something that obviously happens when people are on vacation, or perhaps they're snowbirds and that kind of thing. So it's not uncommon, and funeral establishments know how to handle that. Again, if you can't find out, just contact the BAO. You'll see our contacts at the end of this slide deck, and we'd be happy to guide you through that.
That's great, David. That's all we've got for so far.
Great. So here's some don'ts now. So don't keep your wishes to yourself. Don't leave it for your family to figure out in their time of grief. And yeah, procrastination is great, but you can put it off the next day and the day after, but it keeps the problem going. And the longer you put it off, the harder it gets to make a decision, I find. So we really, again, encourage people to make their pre-arrangements, or even better yet, a will with their arrangements in it, telling people where your will is. And don't avoid talking about it. Yeah, it's a difficult topic. It's never going to be easy, but it is a part of life. And in fact, some of the images you've seen in my slide deck here are quite intentional. One of my jobs 5 years ago when I started at the Bereavement Authority was to give it a sort of look and feel in terms of the website and other communication things like that, our annual report and the consumer guide. And I decided that they should look like how people live, because death is just a part of life. And that's very much what we want, how I want people to approach the very subject by, because otherwise it's just that much more difficult. So we used to have some books that were sort of dark in color. The books were really good, but they had a dark, watery cover on them. And I thought it's a bit foreboding. It's a bit of a barrier, and we're running out of the old stock. So I thought here's an opportunity to redo them. And so we want you to know that we're as welcoming as these images show you we are. We welcome your emails, your phone calls, and just to peruse our website, which probably has more information than you want to know, but the key stuff is the consumer information guide, and it's readily available right there off the first page. Thank you. All right, so who decides? Yeah, that's a very common question. Those with legal authority to make arrangements for the deceased, and here they are. So an estate trustee, a spouse, adult children, or parents of the deceased. Now, an estate trustee can also be known as an executor or executrix. And that person, again, if their will spells it out, it's so much easier. And I know we're a bit of a broken record on that, but if you can write a will, and it doesn't have to be very lengthy, Most of us don't have multiple holdings in multiple countries and 5 or 6 spouses in our history. So it can be quite easy, actually. And I believe that for the majority of you on this call, your situation wouldn't be too much different than mine in that respect. So it can be pretty easy. If it's more complex and you do have a lot of holdings and you do have various business interests and other things that complicate it, then sure, go to your lawyer and get it done that way. It's very much worth the effort. If the deceased had a pre-arranged or prepaid funeral service, we ask that the family knows where it is so they can refer to it. So it's there right in front of them. And again, it just alleviates one more piece of stress when someone's in grief. All right, go to the next slide. So if the death is at home, long-term care or hospice, and I thought I'd just get some information really to connect to Dr. McNaughton-Filion's her presentation, because it's readily available. So I just condensed this from the provincial government's website. And so here's what to do. For an expected death, call the doctor who is caring for the deceased person. And you heard Louise say something like that with more detail. For unexpected death, of course, call 911 emergency services. And if there's no available doctor or emergency services in the area, contact your local coroner's office. If you're unsure about the circumstances, again, contact the local coroner's office or the Chief Coroner of Ontario. Dr. Durkheyer, he might not pick it up himself, but I talk to he and his staff frequently throughout the year, and they're also very welcoming people. Okay. Okay, so here's a little bit about transfer and funeral services, and I talked about that just a little bit up front. So in Ontario, a doctor or coroner completes that medical certificate of death when someone dies. And I'll go over this quickly because Louise covered this so well and in such great detail. The doctor who treated the patient during their last illness or coroner can complete the certificate. Contact the transfer service to transfer the body for funeral service arrangements. And if you want to know where to find them, if you're dealing with a funeral home of any kind, they will know. They may even have a direct connection to one. Most likely they do, and they can make those arrangements for you, or they can advise you as to how to transfer your loved one's body from, say, home or hospice to the funeral home. It's legal for you to do that. There are a few details, but in general, it's legal for you to do that if you're the direct family. Let's see, a funeral home can make the transfer arrangements on a family's behalf. Yes, that's right. And again, they probably will contract with a transfer service operator, which very often can be a smaller operation of only a few people, or sometimes it's part of a much larger business, depending on the organization or the establishment you're going to. And I've already talked about family or friends at no charge. That's the key. If they're charging money, then they have to be licensed by the BAO, because it can't be a business. It has to be a family.
David, I'm just going to interrupt you there because there's a question about sorry, can you go back to the previous slide? The location. So this is following death at home, long-term care, nursing home, or hospice. Is it the same situation from a hospital? Somebody's asked the question about a family where the healthcare provider at a hospital tells the family that they must choose a funeral home and they can't move the body themselves.
Yeah, there can be reasons why you wouldn't want to transfer a body directly yourself, depending on how the person died or the condition of the body. So there can be reasons for that. There are sometimes a funeral home will even say that, advise that to a family. For example, if there are fluids involved, then it's not something that really you would want a family to be moving, and they might not want to either once that's indicated to them. Oh, any other questions?
Well, yeah, there's one other one. So,
I thought I saw.
and I don't know if this is something, this might be something more locally for decision makers around the EDIT, the expected death in home. I explored having funeral homes or cremation services do the pronouncement of expected deaths at home rather than home care nurses because of the limited availability of nurses at times in our area, and they need to come to the home anyway to remove the body.
Yeah.
Is this something that you've heard of, David?
No, they cannot pronounce that. They come in, all of the people we license. So let's say a funeral director, they are totally postmortem. So they don't deal with that. They deal with after the person is declared deceased, or and I think Louise could probably fill this in better than I.
Yeah, I mean, when anybody can pronounce death, but in order to have a body moved, number one, it's either the family has to have the body moved or the coroner. Somebody has to have possession of the body, and you really, when you're thinking practicalities, um, asking the funeral home to come to pronounce, again, as Dave says, they only come when they're deceased.
Yeah, that's not their training at all. Every probably 3 or 4 times a year, I look at what's happening in news locally and around the world. There's a story where a person springs up from their casket at their own funeral because they were thought to be dead, but they were not. It's very rare. I haven't heard of it in Canada. But I read about it in several countries, in legitimate news sources, by the way, not just some random blogger. But so it does happen. And that's why we're a little more strict about it, I think, in this country and in this province.
Yeah, and I can tell you it's happened a few times, but we have clamped down on it, is when brain death is diagnosed in hospitals, they will call the coroner sometimes because the family is not accepting that the person's deceased. And we remind them that we only get called when the person is deceased. So they've got to figure that piece out before they call us. We're not going to come in and say that the person is deceased.
Yeah, interestingly, people have been talking about MAID in the chat, medical assistance in dying, and it can be done just about anywhere, including a funeral establishment. It hasn't been something we've had to deal with or that we've heard about, so I don't think it's happening too often yet, but it could be, and it's something that there would be no law against that if anyone was thinking of doing that procedure. They just have to find an establishment that was okay with it.
One of the comments was that family members were pronouncing expected deaths at home during COVID in very rural areas of the province.
Yeah, that would have to be something that would be dealt with at a level certainly higher than mine. But it's good to raise it.
Okay, should we
Yeah.
go on to the next one? Okay, all right. Thanks for your questions there, folks. Appreciate it. So arrangements and or services. You can choose a funeral or you can have a memorial. You don't have to have a funeral, as most of you probably know. Lots of people have celebration of life, and they'll have that sort of thing maybe months or weeks after someone has died, and they go to a restaurant and they celebrate that person's life. Meanwhile, maybe a few days, months before, the direct cremation was done, that sort of thing, and they put off having a sort of service or just an informal gathering until later, and that happens all the time, and that's perfectly fine. And increasingly, that's actually something we're seeing in the bereavement sector itself. We're seeing more of that. So services can be a variety of different things. They can be public, they can be by invitation. Or you can have an elaborate, what we might call traditional funeral, where there are visitations before the funeral service, and this could go on over the course of a couple of days. And ceremonies can be done in someone's home. And as I said, in very casual settings as well, as long as there isn't a body present. So you can't have a body with you at the restaurant. It should go without saying, but sometimes we get some odd questions coming into us. So I always try to just say those as well. And so direct cremation, for example, is also something that people are choosing so that they can have those informal and frankly less costly ways to mark someone's death. I think I said this before, but when you go to a funeral home, they may also do some of the paperwork for you. And a lot of people appreciate that service. And that'll be a billable thing that you see on your funeral contract. Not only that, you can, I'm getting ahead of my slides here a little bit, but it's your right to know the price list before you make any kind of decision. And I'll be talking about that shortly. Yeah, so you can do a lot of things as family or friend of the deceased. No arterial embalming. I think you would probably guess that one. You know, we talked about some of the more common dispositions out there, and just to highlight them again: burial, cremation, and alkaline hydrolysis. And again, I think, yeah, in fact, I know there are 6 of those facilities in Ontario, and there may be more of them as time goes on. We've had some interest from a few other organizations as well. Green burials. Yeah, I talked about this a little bit, but it's an interesting one because it really fits the moment, or actually quite an ongoing moment in terms of interest in the environment, which is a wonderful thing. And green burials often fit that definition for people because they're uncomplicated. There's no embalming. Very often it's a biodegradable casket. I didn't mention earlier that it also includes how the cemetery is cared for. So most traditional cemeteries cut the grass and have gravestones that are engraved, and the markings are clear, and the grass is kept nice and tight, like your front lawn. It can look really great, and they're often very wonderful places just to go for a walk, which you can. Very peaceful places, and if you're just walking and enjoying a stroll, cemeteries very often don't mind that at all. In fact, it's kind of good for them to have people coming into their property in terms of potential of vandalism. Nothing is more welcoming to people who might do some vandalism, might damage property if there are people regularly walking through. So they often welcome it. And then some of the other things you might not know about a green burial is they tend to avoid motorized equipment. They tend to avoid elaborate headstones. There might just be initials chiseled into a rock, like that one there. In fact, I blurred out the person's name because that stone was for a child about 10 years old. So they put the name of the child on there. And this is how that family wanted to honor their son. And the grave marking itself can look pretty natural. And this surrounding, you might not even know you're at a grave site, except that this would be within the grounds of a funeral, of a cemetery. So cemeteries can have a certain lot set aside, and Niagara Falls has one that the city runs that is great for this. It's called Whispering Ridge, and it has a section that is set aside just for green burials, just for natural burials. And the rest of the cemetery is pretty traditional, what you would expect to see. So we're seeing more and more of that. We're seeing some that develop only as green cemeteries for green burials. And those are for people who want something that's strictly environmentally friendly and not really part of a more traditional cemetery. So we're seeing a lot of different interests from people in terms of their final dispositions. Thank you.
So just quickly, I'm going to go turn the lights on. Speaking of environmental, the building's just darkened.
Oh, you're working late. I thought she was hosting a podcast there for a second. Here's something I mentioned earlier, and we want you to know that it's your right to see the price. So I'm old school for the graphic. I used Bob Barker here instead of Drew Carey. But it's your right to see the price, and operators must post their price list for every service or product that they sell. and it has to be posted on their public website. If there are any funeral establishments out there who don't have a website, then they have to provide it in print to you. And it's perfectly within your right to ask. In fact, they would welcome you asking to see it anyway. And really, it just allows you, and some people find this a little bit difficult, but to compare prices. And so, yeah, no one's in the mood to shop around when this happens in their family, but that option is there for you. And it's just a way for you to ensure that the prices you're seeing are within a very standard range, because heck, we don't deal with this very often, and which is you know, what everyone would regard as good. But the downside to it is we wouldn't know, most people wouldn't know what standard prices are in the death care sector. So that's one of the reasons why they're there. The other is just to protect you so that the price suddenly doesn't just get escalated to some high number because you know, some less scrupulous person is looking to make an extra buck off your grief. And in fact, this sort of regulation oversight that we provide is welcomed by the vast majority of the death care sector, because they want it to be known to be regulated and professional for you. So there it is. You can see the prices of any funeral establishment right on their website. It's probably right on the first page. That's where I see most of them myself. There's a link for it. They also have a link, or rather a web badge on it that says they are licensed by the Bereavement Authority of Ontario. Because believe it or not, there are websites out there, maybe you've seen this, who copy and paste obituaries from legitimate funeral homes and legitimate obituaries. Might even be in the local newspaper's website, and they post it on their own website and start selling products off it. Unknown to the family gets nothing out of it. They sell flowers, they sell memorial gifts. It's really unethical, not illegal. And that's the problem. And we don't regulate sales on the internet that are not being done by our licensees. And that is, in fact, who does those things. And it's something we've made the public aware of through a variety of alerts and a whole lot of media interviews that I've done over the last 3 years. And it's often called obituary piracy. And I said to one reporter that unfortunately it's like whack-a-mole. Once we identify one and that company is ostracized or sued, and one was sued, then another one pops up later doing the same thing. So the best defense is knowledge, vigilance. So verify. If you're unsure, check with your local funeral home, and they can tell you whether or not that obituary is theirs, and if the links are to things that the family wanted, and they'd welcome your call. And if you're really not sure, just give the BAO a call or email us, whatever you like, and we'll talk to you about that. Right, so cemeteries are...
Sorry, just before you go ahead, somebody asked, and related to the costs, what if you can't afford to have the services of a funeral home or a crematorium?
Right. So there are socially assisted burials, and funeral establishments often, well, they do those. They connect with the cemeteries, or the cemeteries do them directly, and they're paid through, often municipalities have a social assistance burial program, if you want to call it that, and that's how it gets done, and it's not uncommon. And in fact, I know Louise was talking about that in her presentation as well. Okay, no other question? Okay, thank you, Valerie. So cemeteries must be licensed by the Bereavement Authority, and that's the law. And it's really all about care and maintenance, because they don't take care of themselves, and it doesn't take long before natural vegetation or grass or a tree falls, and things not only become difficult to access and walk in, but even unsafe. So it's part of their responsibility as a cemetery operator to maintain that cemetery. And there's a fund, it's called the Care and Maintenance Fund. And money from all of the burials that have gone before, a percentage of that is taken, sometimes is well, it's about 40%, is put aside to the future of that cemetery. And so that can include regular maintenance, cutting the grass, that kind of thing, just every day, every week. Or it can be for in the distant future when that cemetery is no longer taking new business. Basically, when the cemetery is full, there's no other place for it, but the cemetery still has to be maintained. Well, that trust fund that's created, and it is a trust fund, is where the money is drawn from. The interest from it goes to simply maintain that cemetery. And it's been used for a lot of well-established and very old cemeteries. It's been used for small cemeteries as well, where the town has moved on. So it's a very small town. Whatever the business was there in its previous years is gone, and people have moved on. It could just be a hamlet, but maybe they had 3 or 4 cemeteries with just 20 or so plots. Who's going to take care of it? So the Care and Maintenance Fund will do that. There's also the example of cemeteries that become abandoned over time, and people actually scarcely know they even exist. And these cemeteries become known very often in rural Ontario on farms. Sometimes families buried their deceased right on their property at a big farm, and there'd be a corner of that farm where their own personal graveyard was of just family members. There may be 10 people buried there, or there may be even only fewer than that. But when the land is sold, then it becomes an issue. So the message I always give people and the news media is that cemeteries are forever. So moving a cemetery is very difficult to do, especially if it's really old and there are no descendants of the deceased alive to give their permission to move the deceased's remains. And if that permission isn't accessible, then that cemetery will stay there in perpetuity. And that's because life matters, and the lives of those people, even though they're unknown, are important. And cemeteries exist in memory of those who died, and in the fact that we as human beings matter, to put it as simple as that. So it's very rare. It has happened where people give their permission for bodies to be moved, and they're moved to another cemetery. And that's respectful because it's done in the light of day. It's done with everyone knowledgeable who's involved and has their authorization. We talked about trust funds already. Here's just a few cemeteries. They can vary in size greatly. So St. James Cemetery on the right in Toronto is huge. I couldn't even tell you offhand how many people are buried there. It's been there for more than 100 years. It's a beautiful cemetery. It may sound strange to say, but it really is a peaceful and beautiful place to walk. I've been in there a few times. They did, one of the biggest moves of cremated remains in Ontario history and perhaps in Canadian history only about 3-4 years ago. And they moved 5,000 cremated remains from one embankment, put them in storage, did this all with the permissions of the family members or the descendants of the family members who were cremated, so they could shore up an embankment, which was eroding. And all of those cremated remains and their grave sites would have washed away more or less toward the Don River. So that was done with permission, and they were all moved back very successfully. Everything was marked very clearly, done very respectfully. And so there's an example of the movement of a burial site within a cemetery that was handled very professionally and with a lot of attention to respect for the dead and for the families. Then you have Reed Cemetery over here in Brockville, much smaller cemetery, but one that's also been there for a very long time. And then there's St. John's Dixie in Mississauga, and there you see columbarium with many niches containing cremated remains. So lots of different places and varieties of forms of disposition, and columbariums are becoming increasingly popular as well as people turn to cremation as their preferred method. And so you could bury them at a gravesite. You can scatter them over Crown land. You can scatter cremated remains, Crown land, as I said earlier. Don't have to ask anybody's permission. Or you can put them in an urn and in a niche, and multiple niches. And those of you who are older than 25 probably know about all these things. When I talk to people who are 25 or younger, I tell them that life is actually finite. You don't get to be 25 forever. And some of them laugh and some of them think, oh, sure, boomer. But anyway, I like to speak frankly about this stuff. Okay, so that's it for that slide. Yeah, so licensing has another interesting aspect that is, I guess, something that's special to the sector that we regulate, and that is preserving of cemeteries, including history. Underground railroad cemeteries. So that's where people who were fleeing slavery in the United States came to Canada, settled here in many different parts of the province, mostly in this, closer to the border where they came from, and lived their lives and died. And some of their cemeteries over time, like other cemeteries, became abandoned over time. So that as people moved away, there's no one there. People basically didn't know they were there. Some of them were known, just word of mouth among people. And one cemetery that came to the Bereavement Authority's attention about 3 or 4 years ago was in Haldimand County. And it had really interesting history in terms of the Underground Railroad. And that cemetery didn't have a care and maintenance fund because it predates the very existence of such a thing. So what happens in that case? And there are many cemeteries like this, not just underground railway cemeteries, but cemeteries in Northern Ontario and other parts of the province where people come across them. They're out taking pictures. They're out on a hike, cross-country skiing. They come across some gravestones. And what happens is, if they're not part of an existing cemetery, and they rarely are, they have to be assumed by somebody to take care of them. And that somebody is a municipality. And we work very closely with municipalities to help them do that because it's an added burden for them. So, imagine you have a smaller municipality, maybe it's like Haldimand County, and your tax base is very well used by your citizenry, and in terms of having spare money for unexpected responsibilities isn't something that you're hoping for, and you have a tax base to answer to, and it becomes problematic for the municipalities. So we do what we can to make it a very smooth process. We're just one of the many steps they have to take to have the cemetery ultimately licensed and regulated by us. And then the municipality, after they've gone through a few hoops, and there are a few hoops to go through: Transportation Ministry, Ministry of the Environment, conservation authorities. All these things are things they have to do in addition to becoming licensed by us. So we try to make it very, very easy in terms of getting this done. And we are very supportive of municipalities taking over cemeteries that are abandoned or became abandoned over time. And we thank them for what they do, because it's a heritage, whether it's an Underground Railroad cemetery or another, a different one, a different community. It's still very important to our history, our heritage, who we are, and how we take care of our dead says something about us today. So it's something we regard with great reverence. All right. Any questions at this point, Valerie? Are we good?
There was a really specific one, but I answered it, just about pacemakers and how funeral homes would remove the pacemaker before cremation or alkaline hydrolysis.
That's in the consumer information guide as well. And yeah, thank you for answering that. And it's something that actually funeral directors are trained to do, is to remove pacemakers, which is something I did not know until I started working in this sector myself. I already talked about, telling us about abandoned cemeteries, but the purpose of this particular slide is for me to tell you that we try to connect with the public in ways that are more user-friendly, let's say. So yeah, we can talk about all the different ways that a body can be disposed. We can talk about all the different funeral services you have. But ultimately, we want people to have a comfort level in talking about these things. So 3 years ago, I started a little magazine for us. It's a free magazine. It's called Beyond. And it talks about, yep, all the services we provide, including the items in the consumer information guide and how our oversight works. And we talk about obituary piracy and issues like that that can come up in the news. And we also talk about medical assistance in dying. We don't regulate it, but it's adjacent to what we do. So we have feature articles that come in to draw you in so that you can become comfortable and hopefully even read something interesting. And we try to include that. We have a lot of historical articles about who's buried at various cemeteries and their significance in Canadian history. So that's what the magazine offers. Again, it's available on our website. It's called Beyond. The links to it are on the first page, but I can show you a few of those in the links coming up. That's good. So there they are. Our website's really easy, thebao.ca. And we have the magazine there and the consumer information guide. It's 24 pages and it's online. And funeral homes give them out for free to you in print. Just recently, we started doing it in a 2-page condensed version, partly because it's a lot to absorb when you're sitting there at the funeral home. 24 pages, what's this about? So the 2-pager just gives you a preview. It has a link to the full 24-pager. If you want the full booklet, we'll send that to you free of charge, and the funeral home may have some on hand. If they don't, they'll let us know that you want one, and we'll ship it to you. Most people these days prefer it digitally because it's very handy. There's the direct link, but the links ultimately can be found at thebao.ca. That's how you can reach us, by email or give us a call, and we'll answer your questions.
Thank you so much, David. That's great. We're pretty much at time, and I just want to take a moment to say to both Dr. McNaughton-Filion and David, we had one of our colleagues, Diane, say in the chat, like, these need to be 2 separate presentations because they're both fascinating topics. And I think, the passion that both of you show for the work that you do and the organizations that you work for is really shone through in your presentation. The theme of our Thursday evening series this year has been the other elephants in the room. And I think, both of you brought up topics that are not easy and that people don't really think to talk about or like to talk about them. But I think, the information that you've shared tonight is really, it'll empower the healthcare providers and the volunteers that have been here tonight to better support the people in their care. So I want to thank you both so much for your generosity and your time and to prepare for tonight and to be with us here tonight.
Oh, while we're just talking, while people are just getting off, don't call the local coroner's office, call the 1-800 number, because the local coroner's office is only open Monday to Friday, 9 to 5, but that 1-800 number is valid across the province.
Great. And does it, like, when you call that central number, does it get a chimney to a local?
Yeah, basically what happens is you call and they say, "Oh, who are you?" And you say, give them the story, and then they'll either direct you to the investigating coroner, or they'll direct you to the maid investigator, or they'll direct you to the coroner investigator, depending on what your presentation is. So that, and now we're using it for body transport, as you probably know, Dave, eh?
I see that. Yeah.
Yeah.
I see that from Dr. Heyer.
Yeah.
So,
Oh, and the other thing is transferring bodies. Don't, like, for the people in Prescott, Russell, Hawkesbury, Pembroke, all that area along the Ottawa River, you can, and I'm sure David, you know this, if you are going to transport a loved one, you can't go into Quebec because Quebec will not allow you to transport
Right.
a body.
Yeah, each province has its own form of regulation, and so different rules, different laws. So it can be more difficult just in terms of complications because the laws are different.
That's on page 12 of the guide.
There you go.
Good plug.